So my name is Dr. Kavita. I'm a physician on the South Shore of Long Island. I was diagnosed pretty unexpectedly at 47 years old. I have no family history. My genetics are clear. I went for a mammogram, and it turns out I had a 3-centimeter invasive ductal carcinoma of my right breast. What was unexpected to me was actually how quickly and wonderfully the team at Northwell responded to all of my concerns. They really treated me individually as a person. I wasn't just another case for them. They let me pontificate about like, well, what if we do this, or can we do this? They never made me feel like they were putting me in a box. And that was the most important part of my entire journey to date. So I was very lucky as a patient to come across Dr. Kadison. He is a surgical oncologist. He has never heard me say this, but rumor on the street is he's got hands of gold. I can say that that is true. You know, again, as a physician, you kind of want to find out, like, who are the people that you're going to go to? Who is the doctor going to use to treat themselves? And along with Dr. Kadison, I had the real fortunate advice to see Dr. Neil Tanna, who is an amazing reconstructive surgeon. They really worked hand in hand. And so I was really fortunate to find two surgeons who got me.
So it was an interesting journey for my end as well, because when she first called me, she was adamant about having a bilateral mastectomy. And I said, you know what, why don't you see Dr. Tanna, hear about the reconstruction, and in the end, she circled back to having bilateral mastectomy. And then the question was, are we going to do the standard open regular mastectomy technique, or are we going to think about doing the robotic approach using the clinical trial? She was the candidate for the robotic approach, and that's ultimately what she decided to do.
And independent of the mastectomy, we talked that through and made that decision, and she really wanted to go with an implant reconstruction. You know, we do the entire reconstruction through that small incision on that, lateral chest wall bra line area. So that's what she had simultaneous to the robotic mastectomy in one setting, both the mastectomy and the reconstruction. You have to go on, a guided experience. And so you can't rely on too many people outside. So you have to trust in your surgeons. And that's what she did.
Breast cancer, worst club to be in, best members. I think that there are a lot of people who share this journey that you don't realize. But I have to say, I was joking, these guys tried to kill me and these guys saved my life. I'm gonna be alive to see my children get married. That's a big deal for people. The thing that I'm most looking forward to is just knowing that, okay, I made it through that first year. I'm proud of myself that I did it.